NCLEX PN Practice Questions 121-131. Flashcard 1. It is the start of the shift, and the nurse has just finished listening to a report on 4 clients. Which client should the nurse assess first? A. A client with a diagnosis of an acute traumatic brain injury who has a blood pressure of 88/58B. A client with a diagnosis of a concussion and who doesn't remember the motor vehicle accident. C. A client diagnosed with fibromyalgia and has signs of meningeal irritation. D. A client diagnosed with generalized seizures who complains of a headache following an observed seizure. Think of the answer before the reveal. The answer is: a hypotension adversely affects cerebral perfusion following a traumatic brain injury. Both hypotension and hypoxia are the greatest threats to functional outcomes in brain injury and must be corrected early, taking priority over other interventions for brain injury. Headache after a seizure is expected, amnesia is common with a concussion, and meningeal irritation is an expected finding with fibromyalgia, making these clients a lower priority at this point. Flashcard 2. The nurse discovers that a chest tube has become disconnected from the main connection site of a closed chest drainage unit CDU. What immediate action should be taken by the nurse? A. Cover the insertion site with a sterile petroleum gauze pad. B. Submerge the distal end of the tube in 2 4 cm of sterile water. C. Reconnect the drainage tube to the chest tube. D. Clamp the chest tube nearest to the client with a rubber-tipped hemostat. Think of the answer before the reveal. The answer is B. If the tube becomes disconnected from the main connection site of a CDU, the nurse should place the end of the chest tube in a bottle of sterile water or saline solution while someone else prepares a new CDU setup. The healthcare provider should be called. The nurse should expect an order for a chest X-ray. To prevent the chest tube from coming apart, it's important to spiral tape the main connection site and not to let loops of tubing hang down the side of the bed. If there is an air leak from the chest, do not clamp the chest tube, as this will cause air to accumulate in the pleural cavity, potentially leading to a collapsed lung or tension pneumothorax. Only if the chest tube becomes dislodged from the client does the nurse need to cover the insertion site with a sterile gauze dressing. Flashcard 3. The client states to the nurse, "I am ready to stop all of these treatments. I just want to go home and enjoy my family for the little bit of time I have left." Which action is most appropriate? A. Call in a referral to a social worker and explain that the request will need to be discussed in more detail at a later time. B. Encourage the client to discuss this decision with the healthcare provider and family. C. Tell the family members that the client's preference is to go home to die. D. No action is needed at this time unless the client repeats the statement to another caregiver. Think of the answer before the reveal. The answer is B. The client has the right to stop treatment and should be supported in clearly communicating this decision with the healthcare provider and family. The nurse needs to act as an advocate for the client. It is factually incorrect to wait until the request is repeated. Clients should not need to express their wishes repeatedly before caregivers listen to them. The nurse should not be the one to share sensitive information with the family. The client controls that information. Social services may get involved, but time is of the essence for those who are terminally ill. Flashcard 4. A client who is newly diagnosed with hypertension is prescribed benazepril. What is the most important point to make when teaching the client about this medication? A. Notify the healthcare provider if there is a change in your voice. B. Monitor your blood pressure and pulse regularly. C. Take medication as directed at the same time each day, even if you feel well. D. Call your healthcare provider if you develop a dry cough. Think of the answer before the reveal. The answer is abenesprolotensin is an angiotensin-converting enzyme ACE inhibitor. Even if you don't know this drug, remember that the spelling of ACE inhibitors usually end with pril. One of the side effects of ACE inhibitors is a dry cough. Sometimes the cough is severe enough to require discontinuation of the drug. But the most important point to make is that if the client's voice changes or sounds funny, or there is any swelling of the lips, tongue, or throat, the client should contact the healthcare provider because this could indicate angioedema, a potentially fatal condition. Flashcard 5. A 10-year-old child is recovering from a splenectomy after a traumatic injury. The child's laboratory results show a hemoglobin of 8.8 g/dl and a hematocrit of 26%. What is a priority approach that the nurse should include in the plan of care? A. Promote a diet rich in iron and lean red meats. B. Restrict the consumption of carbonated beverages. C. Plan for regularly scheduled rest periods. D. Encourage bed activities and games for the next 5 days. Think of the answer before the reveal. The answer is C. The initial priority for this client is rest due to the lack of sufficient red blood cells to carry oxygen. The normal hemoglobin is between 10.0 and 15.0 g/dl, and the normal hematocrit is 35% to 45% for a child this age. Note that all of the options are correct actions that may be used for various reasons. Flashcard 6. A child presents in the emergency department with a documented acetaminophen poisoning event. In order to provide counseling and education for the parents, what information should the nurse understand? A. Hepatic problems may occur and may be life-threatening. B. Full and rapid recovery can be expected in most children. C. This poisoning is usually fatal because no antidote is available. D. The problem occurs in stages with recovery within 12 to 24 hours. Think of the answer before the reveal. The answer is a clinical manifestations associated with acetaminophen poisoning occur in 4 stages. The 3rd stage is hepatic involvement, which may last up to 7 days and be permanent. Clients who do not die in the hepatic stage gradually recover. The antidote for acetaminophen overdose is N-acetylcysteine NAC. It is most effective when given within 8 hours of the event and can prevent liver failure if given early enough. Flashcard 7. The client was admitted 2 days ago after a CT scan of the head revealed a basilar skull fracture BSF. What assessment findings does the nurse anticipate with a BSF? Select all that apply. A. Bruising behind the ear battles sign. B. Bruising around both eyes raccoon eyes. C. Hearing loss. D. Purulent drainage from the ear. E. Unilateral redness and swelling over the mastoid bone. F. Facial numbness. Think of the answer before the reveal. The answer is a BCF. Basilar skull fractures often result from automobile accidents, including auto/bike accidents or abuse. Clinical findings of a BSF include raccoon's eyes and battles sign, but these don't show up until several hours or even days after the injury. Battles sign is bruising seen behind the ear. Raccoon's eyes result from fracture of the base of the sphenoid sinus. Other findings may include vision changes, hearing loss, and facial numbness or paralysis. Purulent drainage is associated with infection. Redness, swelling, or tenderness over the mastoid bone indicates mastoiditis, which is usually caused by a middle ear infection. Flashcard 8. A nurse is caring for a client who is receiving total parenteral nutrition (TPN) and lipids. What is the priority nursing action on every 8-hour shift? A. Monitor blood pressure, temperature, and weight. B. Change the tubing under sterile conditions. C. Check serum glucose level. D. Adjust the infusion rate to provide for total volume. Think of the answer before the reveal. The answer is C, because of the high dextrose, about 4 to 5 mg/kg/day content in parenteral nutrition. Plasma glucose should be monitored every 6 to 8 hours. Fluid intake and output should also be monitored continuously. Plasma protein serum albumin, for example, and prothrombin time, plasma and urine osmolality, and calcium, magnesium, and phosphate levels should be measured about twice a week. Flashcard 9. The nurse is teaching a group of parents about poisoning risks in the home and how to report information in the event of an accidental poisoning. The nurse should instruct the parents to first state the ingested substance and then to state which of these points of information. A. The currency of the immunization and allergy history of the child. B. The parent's name and telephone number. C. The estimated time of the accidental poisoning with a confirmation to bring the ingested substance containers. D. The affected child's current age and most recent weight. Think of the answer before the reveal. The answer is D. All of the points are important. However, after the substance is given, the current age and the most recent weight are the priorities. This gives the healthcare providers an opportunity to calculate and prepare the needed dosage for an antidote in preparation for when the child arrives. After this information, the time of the accidental poisoning would be next in importance, with the history of immunizations as a last item of concern. Flashcard 10. A 34-year-old female who has been experiencing widespread muscle pain and fatigue is diagnosed with fibromyalgia FM. Which statement by the client indicates she does not understand the treatment options and needs further instruction? A. I should take duloxetine Cymbalta once a day, every day. B. I will avoid caffeine, sugar, and alcohol before bedtime. C. If I forget to take the pregabalin Lyrica in the morning, I can take it with my evening dose. D. I will take an exercise class, maybe I'll sign up for a yoga class. Think of the answer before the reveal. The answer is C. Treatment of fibromyalgia is multifaceted and individualized. Both conventional and alternative treatments must be considered. Pain management includes medications such as pregabalin Lyrica and duloxetine Cymbalta. Pregabalin, which is an anticonvulsant, is usually prescribed twice a day. If a client forgets to take a dose, she can take it as soon as she remembers, but should never take 2 or more at the same time. Duloxetine, a SNRI, is the only antidepressant approved by the FDA to treat fibromyalgia pain and is taken once a day. Flashcard 11. The client, who survived an out-of-hospital sudden cardiac arrest, has induced hypothermia protocol started in the emergency department. What is the most compelling reason for actively cooling a client after sudden cardiac arrest? A. Protects the skin from breakdown. B. decreases urinary output and fluid needs C, decreases the risk of systemic infection D, improves survival without brain damage. Think of the answer before the reveal. The answer is D. Inducing therapeutic hypothermia counteracts many of the destructive mechanisms of cardiac arrest in the brain, which means that the client may survive without long-term neurological impairment. There are a number of risks associated with this treatment. For example, it suppresses the inflammatory response, increasing the risk of infection. Also, it causes mild diuresis and increased urine output, which is why the nurse needs to carefully monitor fluid balance. Peripheral vasoconstriction places the client at a high risk for skin breakdown. This risk is increased if cooling blankets are used. Flashcard 12. The child diagnosed with central diabetes insipidus di is being treated with desmopressin nasal. What information is important to reinforce with the family? Select all that apply. A. The child should wear Medic Alert Registered Identification B. It is important to decrease intake of water and other fluids while taking this medication C. Using the nasal preparation may cause a stuffy nose D. A parent or other responsible adult should supervise and help the child use the medication E. Muscle weakness, spasms or cramps are expected and harmless effects of the medication F. The medication increases urine production. Think of the answer before the reveal. The answer is a BCD di results from reduced secretion of the antidiuretic hormone, vasopressin. Desmopressin DDAF is a synthetic analog of the natural pituitary hormone vasopressin that will help prevent the loss of water from the body by reducing urine output and helping the kidneys reabsorb water. All clients taking desmopressin must limit drinking of water and other fluids. Drinking too much water can result in hyponatremia, which can cause muscle weakness, spasms or cramping, as well as loss of appetite, severe headaches, confusion, loss of consciousness, and seizures. Anyone with central di should wear a Medic Alert Registered ID and carry an emergency medical information card. Flashcard 13. A 62-year-old arrives in the emergency department reporting chest pain. Following protocol, the client is given nitroglycerin and aspirin. The initial ECG indicates non-diagnostic changes in ST segment or T waves. What does the nurse anticipate will happen next? A. Obtain initial cardiac marker levels and other labs. B. Prep the client for percutaneous coronary intervention PCIC. Begin oxygen at 4L/min per nasal cannula D. Administer Roman 4 morphine. Think of the answer before the reveal. The answer is a normal or non-diagnostic changes in the ECG ST or T wave represent a low risk of MI, but serial cardiac markers including troponin and other labs should still be drawn. All clients with a suspected MI will have continuous ECG monitoring. Other non-invasive diagnostic tests may be ordered for this client, such as a stress echocardiogram. There's no need for PCI without confirmation of a MI. Supplemental oxygen can have harmful effects unless the client's O2 saturation is less than 95% and there is no information in the question about the client's O2 sats. There's also no indication that the client's pain is not being controlled by the nitroglycerin. Flashcard 14. The client was treated with Roman 4 amiodarone for life-threatening ventricular arrhythmias. The client will be discharged with the oral form of the medication. Which of the following findings will the nurse emphasize as the most serious and requiring immediate notification of the healthcare provider HCP? A. Dyspnea and cough. B. Malaise, fatigue, and dizziness. C. Skin deposits and photosensitivity. D. Gastrointestinal disturbances. Think of the answer before the reveal. The answer is amiodarone is a potent and highly toxic class Roman III antidysrhythmic. A serious side effect of this medication is pulmonary toxicity, which is why a baseline chest X-ray and pulmonary function tests are needed prior to treatment. The client should contact the HCP to report any dyspnea, cough, or any other type of breathing problem while using the medication. Taking the medication in divided doses with meals can help with GI disturbances. The client should not drive until the effects of the drug stabilize and the body adjusts to it. The client should use sunscreen and protective clothing when outdoors. Skin deposits are common but benign. Flashcard 15. On the second post-approved day, a 79-year-old female who was previously cognitively intact becomes agitated when she begins having auditory and visual hallucinations. The client later demands to leave the hospital. What action does the nurse take next? Select all that apply. A. Contact the primary physician to evaluate the client. B. Inform the client that insurance will deny payment for leaving against medical advice. C. Discuss the situation with the durable power of attorney for healthcare. D. Review the release from liability form with the client and witness her signature. E. Describe the risks and benefits of leaving the hospital to the client. Think of the answer before the reveal. The answer is C. A client has the right to leave AMA. As long as the client is competent and understands the risk of leaving, the client can sign a release from liability form and leave. The nurse cannot coerce the client into staying. It is not true that insurance will deny payment when someone leaves AMA. When there is reason to believe the client does not have the capacity to make decisions, which is the case for this client, the nurse should contact the primary physician, who will then evaluate the client. If the physician determines the client is not functionally competent and the client cannot explain the risks of leaving the hospital AMA, the client can be detained. The nurse should also contact the depot. Flashcard 16. The client arrives at the emergency department accompanied by a family member. The client reportedly has not been sleeping and has gone on shopping sprees. The client is irritable, easily distracted, and becomes physically agitated. Which intervention is the priority for this client? A. Place the client in a quiet and secure area and inform staff of what is happening. B. Provide factual, scientific, and relevant information to the client about treatment options. C. Restrain the client and administer prescribed antipsychotic medication. D. Assess the client's understanding of the reasons for the behaviors. Think of the answer before the reveal. The answer is the symptoms suggest a manic episode. Emergency assessment needs to determine if the mania is primary or secondary to a medical condition or to a substance disorder. Due to the physical agitation, the priority intervention is to place the client in a quiet and secure area and to inform staff of what is happening. The nurse will use short and concise statements and explanations, as well as a calm but firm approach. Restraints, seclusion, and administration of medication are measures that should be used only when clients present a clear and present danger to themselves or others. During recovery, the client will work with a counselor to gain an understanding of the reasons for his or her behavior. Flashcard 17. The nurse is caring for a client diagnosed with substance use disorder (SUD). The client states, "I just drink occasionally. I don't know why my wife and the judge think that I need to be in an alcohol treatment program. Which of the following behaviors are consistent with SUDs?" Select all that apply. A. Craving and inability to abstain from alcohol. B. Prone to act impulsively. C. Able to identify problem behaviors. D. Insecurity in relationships. E. Internally motivated to change. F. Inability to suppress memories. Think of the answer before the reveal. The answer is a BDSUD is a chronic disease where a person persistently uses alcohol or drugs. Individuals with SUD have a craving for the addictive substance and are unable to abstain from it. Despite the negative consequences of abusing drugs or alcohol, they typically are not internally motivated to change. They often demonstrate an inability to identify problem behaviors. They are anxious, insecure, and often have family and work problems. They may experience blackouts and cannot remember what happened when they were drinking, but the inability to suppress memories is not an issue with SUD. Flashcard 18. The staff nurse prepares an 88-year-old female for discharge and confirms that follow-up care for a home health nurse is scheduled. During the medication reconciliation process, the client's husband states he hopes that his wife has learned her lesson and will take her medications as ordered. What action by the staff nurse is indicated? Select all that apply. A. Notify the home health agency nurse about the husband's statement. B. Notify the healthcare provider of the need to delay discharge. C. Ask the husband to manage his wife's medication at home. D. Write a schedule with days and times for the client to take her medication. E. Ask the husband why he thinks his wife is not taking her medications properly. Think of the answer before the reveal. The answer is a D. The staff nurse should first determine what the husband meant and directly ask why he thinks his wife is not taking her medications properly. The staff nurse should help the client understand her medications, why she's taking them, when and how to take them, as well as side effects, because assisting older adults in managing their medications can help prevent hospital readmissions. Since medication management requires a multidisciplinary approach, the staff nurse should also alert the home health nurse about potential problems. Flashcard 19. The nurse will be participating in a quality improvement QI project that's intended to reduce falls at the healthcare facility. Identify the first step that's required for this project. A. Conduct a literature review to find the best practices to reduce falls in similar facilities. B. Review the data about the types of falls and precipitating factors at the facility. C. Implement fall reduction efforts according to current fall prevention protocol. D. Work with staff to revise fall prevention policy and procedures. Think of the answer before the reveal. The answer is B. The first step in quality improvement is to review and evaluate the existing data about falls and precipitating factors at the facility. The next step is to conduct a literature review to determine appropriate best practices and effective interventions. Current policy and procedures are then reviewed, updated, and, finally, implemented. Flashcard 20. The client is preparing for discharge after inpatient treatment for substance use disorder (SUD). During a counseling session with the client's mother, Which behavior is recognized as having the highest potential to interfere with the client's recovery after discharge to home? A. Neglecting her needs to care for the client. B. Offering advice and opinions to the client. C. Setting limits for client behavior at home. D. Ignoring requests for money. Think of the answer before the reveal. The answer is: a codependence has the potential to interfere with an addict's recovery. Codependent behavior includes denial, self-neglect, manipulation, avoidance of feelings, hypervigilance, and many other negative behaviors. A codependent family member gains feelings of personal worth by meeting the needs of the addicted family member and placing the needs of the addict above her own. Offering advice or refusing to discuss money may not be effective, but these probably won't directly affect the client's recovery. Setting limits is usually helpful for people struggling with SUD. Flashcard 21. The nurse manager is preparing for an in-service about efficiency and cost-effective care. Identify a strategy the nurse manager should include in the presentation that's aimed at increasing efficiency and reducing costs on the nursing unit. A. Eliminate reimbursement for continuing education seminars. B. Increase the number of unlicensed staff providing care. C. Limit dressings, packages, and other supplies on the nursing unit. D. Label the cost of each item in the supply closet. Think of the answer before the reveal. The answer is D. When the cost of each item is displayed, staff becomes more aware of costs and may use supplies more wisely. Increasing the number of staff will not affect efficiency. Limiting the amount of supplies will decrease efficiency because of the time factor involved in obtaining needed supplies. Eliminating staff education reimbursement will not increase efficiency and may even decrease efficiency. Flashcard 22. The client is admitted to a rehabilitation unit following an ischemic stroke with right hemiplegia. The nurse observes the client having difficulty performing personal hygiene and other activities of daily living hours. What will the nurse include in the plan of care? A. Instruct unlicensed assistive persons to provide total care. B. Consult with the physical therapist about upper arm strength training and improving fine motor skills. C. Review the occupational therapist's recommendations for the client. D. Contact the case manager to determine the appropriate level of care. Think of the answer before the reveal. The answer is C. Even though the client may initially need assistance, he must be encouraged to participate in his or her care. The rehabilitation plan will include physical therapy for mobility issues and occupational therapy for ADLs, which is why the nurse should review the occupational therapist's recommendations for care. The nurse will consult with the case manager for discharge planning and coordination of care. Flashcard 23. The 75-year-old client has an appointment for a DXA scan to screen for osteoporosis. The nurse understands that which finding is a risk factor for osteoporosis? A. Walks 2 miles every other day. B. Has used corticosteroids for arthritis for more than 2 years. C. Drinks 2 ounces of red wine daily. D. Reports late menarche and menopause. Think of the answer before the reveal. The answer is B. A dual energy X-ray absorptiometry DXA scan is used to screen for osteoporosis. While there are many causes of osteoporosis, the use of steroids over time increases the risk for osteoporosis. Other risk factors include low bone mass, poor calcium absorption, lack of weight-bearing exercise, and moderate to high alcohol ingestion. A late menopause would have increased the client's supply of estrogen, which would help prevent osteoporosis. Flashcard 24. The nurse manager is conducting a staff development program about improving client care outcomes. Which of the following processes will best contribute to improved outcomes? A. Clients with a diagnosis of heart failure will have an indwelling urinary catheter inserted. B. Clients with a history of pressure ulcers will have an air mattress in place within 6 hours of admission. C. Clients will be screened upon admission for methicillin-resistant Staphylococcus aureus MRSAD. Clients with peripheral edema will have blood drawn for a daily chemistry panel. Think of the answer before the reveal. The answer is B. Providing clients with a history of pressure ulcers with an air mattress is a specific example of quality nursing and preventative care. Training clients for MRSA or blood draws are not interventions. Although it may be medically indicated for a client with heart failure, inserting an indwelling urinary catheter will not necessarily improve care or outcomes of care. Flashcard 25. During family counseling, the parents display the dysfunctional phenomenon called triangulation. Which of the following behaviors demonstrates triangulation? A. One parent accuses the other of spending all her free time and giving special favors to the child. B. One parent admits to being disappointed about not having another child and is now volunteering at a children's center. C. Both parents and the child seems to be vying for the family leadership position. D. The parents state that the grandparents and several other relatives will need to be consulted before any decisions are made. Think of the answer before the reveal. The answer is a triangulation is a dysfunctional phenomenon where tension between a dead two people who have a relationship is displaced onto a third-person child, friend, etc. This behavior serves to lower the tension or resolve the crisis in a short term, but often creates new problems in the long term. Sublimation is a mature defense mechanism where the individual transforms losses or socially unacceptable urges into acceptable behaviors such as volunteering. Boundary blurring is the loss of distinction among individuals in a family. Enmeshment is where family boundaries are blurred. Enmeshed families depend on each other excessively and have little autonomy. Flashcard 26. Information about case management and the role of the case management nurse is presented during an orientation session for new nurses. Which statement correctly describes an important fact about case management? A. Physicians are responsible and accountable for client outcomes. B. The interdisciplinary team makes all the decisions for the client and family. C. Case management strategies focus mainly on the client's needs after discharge. D. Case management is a collaborative process designed to meet complex client needs. Think of the answer before the reveal. The answer is D. Case management is a collaborative process of organizing and coordinating resources and services within and across multiple settings. The focus is on cost savings as well as quality and continuity of care. Case management nurses work closely with physicians, nurses, social workers to meet the complex health needs of the client. Case management is client-centric and all members of the team, including the client, work together to achieve desired outcomes. Cases that involve high-risk diagnoses such as HIV/AIDS, cancer, or people with cognitive deficits or high-volume cases such as total hip or total knee replacements are often selected for case management. Flashcard 27. It's mealtime at the long-term care facility. The nurse observes an unlicensed assistive person UAP returning an uneaten food tray to the food cart, where other trays are waiting to be served. What is the priority action of the nurse? A. Reinforce infection control information after all trays are passed. B. Observe the UAP during the next meal to see if the action is repeated. C. Immediately reinforce information about infection control. D. Report the incident to the director of nursing. Think of the answer before the reveal. The answer is C. Returning a food tray that had previously been delivered to a client to the cart will cross-contaminate the other undelivered, clean trays, even if the contents of the tray are uneaten. The priority action is to immediately reinforce information regarding infection control. Waiting until all the trays have been delivered or for another meal increases the risk of cross-contamination and illness. There is no need to involve the director of nursing unless the behavior continues unchanged. Flashcard 28. A Cambodian client witnessed a murder 3 days prior to admission to an inpatient psychiatric unit. The client now reports that a wind has entered my chest and I know I am dying. Which nursing intervention is a priority? A. Establish a therapeutic relationship. B. Challenge the delusion with reality statements. C. Encourage the client to suppress the traumatic memories. D. Discourage visits from the client's family until the medication takes effect. Think of the answer before the reveal. The answer is a Kyle is a panic attack among Cambodians that can occur with acute stress disorder ASD following a traumatic event. Symptoms include the belief that a wind enters the body in the diaphragm causing shortness of breath, tinnitus, dizziness, neck soreness, and feelings of impending death. Establishing a therapeutic relationship is necessary to understand the cultural aspects of the client's symptoms and is a priority in ASD. Challenging delusions assumes psychosis rather than examining cultural indications of ASD. Voluntary memory suppression is not practical nor therapeutic in ASD. Family visits can assist the client via cultural understanding of symptoms and event interpretations. Flashcard 29. A client is newly admitted with acute diarrhea and is wearing an adult incontinence pad. What action should the nurse take before visitors arrive and enter the client's room? A. Ask each visitor to dress in a gown and wear gloves before entering the client's room. B. Call the healthcare provider to request an order for a private room. C. Verify that each visitor is wearing a mask if less than 3 feet (0.9 meters) from the client. D. Remind all visitors to wash their hands before entering and when exiting the room. Think of the answer before the reveal. The answer is, according to the Centers for Disease Control and Prevention, diarrhea in an incontinent patient requires contact precautions. The nurse can implement precautions for a known or suspected infection. The nurse must then obtain an order usually within 24 hours from the healthcare provider HCP. Contact precautions also include standard precautions, such as placing the client in a private room or cohorting. An order is not required for this. Washing hands is very important, but not enough to protect against potential enteric pathogens. Droplet precautions, not contact precautions, involve wearing a mask when within 3 feet (0.9 meters) of the client. Flashcard 30. While caring for a client in a second stage of labor, the healthcare provider requests 1% lidocaine, a 10 ml syringe, and a 23-gauge 1.5-inch needle. What does the nurse anticipate that the healthcare provider is preparing to do? A. Perform an episiotomy. B. Administer an epidural. C. Initiate oxytocin infusion. D. Correct a prolapsed cord. Think of the answer before the reveal. The answer is during the second stage of labor, a healthcare provider would use lidocaine, a 10 ml syringe, and a 23G 1.5 needle to administer local infiltration anesthesia for an episiotomy. Epidurals are typically administered by anesthesia personnel during the first stage of labor. Using a local anesthetic prior to Roman IV catheterization can reduce pain, but requires only an intradermal injection using a tuberculin syringe. Correcting a prolapsed cord does not require lidocaine. Flashcard 31. The client is diagnosed with an anxiety disorder. During a psychiatric interview, the client asks the nurse whether religious practices would decrease the symptoms of anxiety. Which response is the most therapeutic? A. Studies have shown that spiritual practices and religious beliefs help people cope with stress and anxiety. B. We are not allowed to discuss religion with clients in this facility. C. Perhaps you can try out some different churches when you are discharged. D. We have a wonderful chaplain and I will ask him to speak with you today. Think of the answer before the reveal. The answer is scientific studies have demonstrated that religious and spiritual practices enhance the immune system and increase a sense of well-being in people. They are also associated with decreased mental and physical illness. Nurses should respond honestly to clients' questions and provide them with evidence-based information, rather than refuse to discuss the subject. Suggesting church attendance or assuming that the client wants to speak with the chaplain deflects the client request for information from the nurse. Flashcard 32. During a well-child clinic visit, the nurse assesses a 2-year-old child who is in the 50th percentile for both height and weight. The child still breastfeeds twice a day, and the parents report that the child eats a variety of foods that are allowed within the vegetarian practices of their religion. Which of the following is the priority nursing response? A. Let's take a look at what your child has eaten in the past day or two and then discuss how to decrease the risk of dietary deficiencies. B. You will need to contact a licensed nutritionist for information about how best to feed your child. C. Since your child is underweight, I am required to report you and request a home visit from Child Protective Services. D. Your religion may be harming your child, so I am required to refer your case to social services. Think of the answer before the reveal. The answer is a cultural or spiritual belief system can have negative consequences for a growing child. A vegetarian diet that excludes animal products may result in deficiencies in vitamins B12 and D, as well as calcium, iron, and zinc. Further assessment that is sensitive to the family's culture, as well as information regarding how to compensate for missing nutrients, is needed. It's a nursing responsibility to first assess the child's diet before referring the case to a nutritionist. It's non-therapeutic and judgmental to say that this case must be reported to Child Protective Services without further assessment. The child is not underweight, as/she is reported to be in the 50th percentile for weight. Flashcard 33. A client at 29 weeks gestation has been admitted to the antepartum unit. Assessment findings include blood pressure 124/82 and uterine contractions are 8 to 10 minutes apart. The medication administration record includes an order for nifepine. What action by the nurse is appropriate for this situation? A. Administer the medication as ordered. B. Hold the medication until the blood pressure is 140/90 C. Request a substitute medication, such as magnesium sulfate D. Administer the nifedipine with an oxytocin drip. Think of the answer before the reveal. The answer is: a nifedipine is used for preterm labor because it reduces contractility in the smooth muscles of the uterus, causing tachylysis. While it is also an antihypertensive, there are no indications that this client is having issues with her blood pressure. Magnesium sulfate is sometimes used with preterm labor, however, nifedipine has fewer side effects associated with it. Oxytocin, a contraction-inducing or oxytocic medication, would not be appropriate for this client. Flashcard 34. The client is diagnosed with Clostridium difficile C. difficile. The nurse, who does not apply personal protective equipment PPE, enters the room to administer a medication. The client requests assistance to sit up in bed before taking the medication. What is the next action by the nurse? A. Perform hand hygiene with soap and water. B. Assist the client to move up in bed. C. Leave the room to apply PPE. Reposition the client and then apply alcohol-based hand rub. Think of the answer before the reveal. The answer is: a C. difficile is an anaerobic gram-positive bacterium that produces spores resistant to heat, drying, and many antiseptic solutions. The spores are transmitted from client to client via improperly sanitized hands. Meticulous hand hygiene, using soap and water, and strict adherence to isolation protocols will help prevent the transmission of C. difficile. In this scenario, the nurse needs to first wash his or her hands with soap and water and then apply PPE gown and gloves before providing any care. Alcohol-based hand rubs are ineffective against C. difficile. Flashcard 35. The nurse cares for a client diagnosed with pneumonia. During the admission interview, the client explains that her husband died a few months ago and states, "I don't seem to be able to sleep or eat now. I'm not sure I have anything to live for." Which of the following reflects an appropriate nursing response? Select all that apply. A. Are you thinking of ending your life? B. Your loss is devastating and each person experiences grief differently. C. You are grieving, and if you don't feel better in another month, you should seek help for depression. D. I'd like to know more about how you are doing and what you have used for support after your husband's death. E. I need to pass medications, but I will call your daughter to come and talk to you. Think of the answer before the reveal. The answer is: a BD. A client who has experienced the recent death of a spouse will express symptoms of grief that are similar to symptoms of depression. The nurse may not have the expertise or time to differentiate between grief and depression, but based on the client's statement, the nurse should recognize there's a potential for suicide. The nurse should directly ask the client if she is contemplating suicide. Using therapeutic communication and offering of self, the nurse should acknowledge the client's feelings. Offering to call a social worker or family member may be a part of a conversation and plan of care after the nurse has engaged in a therapeutic exchange with the client. Flashcard 36. The client has been hospitalized 48 hours for multiple injuries sustained in a motor vehicle accident. An elevated blood alcohol level was present at the time of the accident. Which finding should be a priority in the plan of care? A. Hallucinations. B. Loss of appetite and nausea. C. Diaphoresis. D. Fine tremors. Think of the answer before the reveal. The answer is the symptoms of alcohol withdrawal usually begin about 5-10 hours following the last drink and peak around 24 to 72 hours. The severity of symptoms experienced during detoxification varies with each client. Individuals who have been abusing alcohol for many years are at risk of developing delirium tremens (DTS). Symptoms of DTs include hallucinations, extreme confusion, extreme agitation, and tachycardia. DTs is a medical emergency. Loss of appetite, nausea, diaphoresis, and fine tremors are symptomatic of the earlier stages of withdrawal. Flashcard 37. There is a new order to apply 1 inch of nitroglycerin paste to the client's chest every 12 hours, but the medication is not in the automatic medication dispensing systems drawer for this client. What should the nurse do next? A. Use another client's nitroglycerin paste until pharmacy sends a tube for this client. B. Substitute an equivalent amount of nitroglycerin sublingual spray from the crash cart. C. Call the pharmacy to send up a tube of nitroglycerin paste. D. Call the prescriber and ask to substitute a different formulation of nitroglycerin. Think of the answer before the reveal. The answer is C. The nurse must call the pharmacy and ask to have the medication sent to the floor. It is never acceptable to borrow another client's medication. This is an example of at-risk behavior, commonly referred to as a workaround. The nurse can never substitute one formulation of a medication for another without a specific order to do so. Giving a medication without an order would be considered a medication error and is an example of working outside the nurse's scope of practice. Flashcard 38. The emergency department nurse cares for a client who has a fractured humerus and multiple bruises to the upper body. The nurse performs a risk assessment screening for abuse. Which question is the priority? A. Have you even been emotionally or physically abused? B. Does your partner hit or kick you when angry? C. Do you feel your life is in danger from abuse or suicide? D. Is your partner extremely and constantly jealous of you? Think of the answer before the reveal. The answer is C. Less than 12% of battering survivors who present to an emergency department are screened for abuse. After establishing a nurse-client relationship, it is most important to conduct a lethality assessment to determine whether the survivor is in danger of homicide or suicide. The correct option asks the client about a life threat. The other options are all part of abuse assessment screening after the risk of lethality has been established. Flashcard 39. During a routine office visit, the nurse compares the client's laboratory results with a report from 6 months ago. Despite medical treatment, the client's total cholesterol remains high. The nurse plans to discuss information with the client about changing behaviors that contribute to cerebrovascular disease. What intervention is the first step towards health promotion? A. Schedule an appointment to review dietary modifications. B. Identify programs in the community to increase physical activity. C. Discuss risk factors on a stroke risk assessment tool. D. Review options for smoking cessation programs. Think of the answer before the reveal. The answer is C. The nurse will first assist the client to identify lifestyle factors they are willing to change, such as changes in diet and activity. If the client recognizes the potential areas for change, the nurse can work with the client to create a collaborative treatment plan that's focused on preventing cerebrovascular disease. The nurse can identify support groups and or programs in the community based on the client's needs and willingness to change. A client-centered approach helps adherence to treatment, which improves health outcomes. Flashcard 40. The nurse reviews the client's plan of care after an exacerbation of chronic obstructive pulmonary disease (COPD). Which primary prevention strategies are recommended to reduce the risk of further complications? Select all that apply. A. Teach the client about the proper use of prescribed salmeterol inhaler. B. Arrange for portable oxygen therapy for home care. C. Educate the client about washing hands and avoiding crowds. D. Make a referral to a pulmonary rehabilitation program in the community. E. Discuss with the client about scheduling an annual influenza vaccination. Think of the answer before the reveal. The answer is CE. Primary prevention includes a wide range of strategies or interventions that will prevent disease or injury before it occurs. This is accomplished by preventing exposure to pathogens, altering unhealthy or unsafe behaviors that can lead to disease or injury, and increasing resistance to disease or injury. Salmeterol and oxygen therapy are secondary prevention interventions for the treatment of COPD. They are intended to reduce the impact of the disease that has already occurred. Pulmonary rehabilitation is an example of tertiary prevention. Tertiary interventions are intended to help clients manage long-term, often complex health problems or injuries. Flashcard 41. The nurse is caring for a 3-year-old child who is hospitalized for a cardiac procedure. Which of the following nursing actions will help reduce anxiety in the child? A. Keep the daily routine close to the usual home routine. B. Ask the parents to leave at night to allow for better sleep. C. Have the child explain why he is in the hospital. D. Discuss the expected outcomes of the hospitalization. Think of the answer before the reveal. The answer is a hospitalization for a child induces stress responses and anxiety. The early childhood developmental stage is most comforted by daily routines that more closely mimic the home routine. During the middle and adolescent stages of development, children benefit from sharing their feelings about being hospitalized and procedures they will undergo. Parents should be encouraged to stay overnight since this helps reduce anxiety in the 3-year-old. Flashcard 42. A 2-month-old is admitted with a fever of undetermined origin. The infant received acetaminophen 2 hours ago and is now sleeping. The parents are refusing to allow the unlicensed assistive person UAP to attempt to measure the baby's temperature because the infant is asleep. What action by the nurse is indicated in this situation? A. Recognize that the parents have a right to refuse treatment. B. Insist that the temperature must be taken now. C. Ask the parents to step outside of the room to discuss the situation. D. Send a different UAP to measure the client's temperature. Think of the answer before the reveal. The answer is a client or the client's advocate has the right to accept or refuse routine assessments, especially when it will not alter the outcome. The nurse can make other assessments, for example, count respirations, observe color of skin, and document these findings along with information that the client is sleeping. The client's temperature can be reevaluated later when the client is awake. Flashcard 43. The nurse is making rounds, checking oxygen equipment and assessing clients receiving oxygen therapy. Which of the following situations require intervention by the nurse? Select all that apply. A. Humidified oxygen delivery system contains water from condensation in the tubing. B. Valves and flaps in the non-rebreather mask will not open C. Oxygen tubing that will allow ambulation to the bathroom is 25 feet 7.6 meters in length D. Humidifier is documented as having been changed 12 hours ago E. The reservoir bag on a non-rebreather mask is inflated F. Nasal cannula tubing is documented as having been changed 8 days ago. Think of the answer before the reveal. The answer is a BF. Clients receiving humidified oxygen need equipment monitored for condensation in the tubing so that water does not empty into the client mask. Frequent emptying of the tubing away from the client is necessary. Valves and flaps in non-rebreather masks must be patent and able to open during expiration and close during inhalation to maintain FiO2. A mask with valves that do not open must be replaced. In a non-rebreather mask, the reservoir bag should be inflated. If it deflates, the client will breathe in exhaled carbon dioxide. Nasal cannula tubing must be changed at least every 7 days and humidifiers changed every 24 hours. Oxygen tubing extensions that allow clients to ambulate to bathroom should not exceed 50 feet. Flashcard 44. The nurse cares for a hospitalized client recovering from pneumonia. The client has been homeless for several years. Which of the following is a priority in discharge planning? A. Arrange for transportation to transitional housing. B. Give detailed instructions for follow-up appointments. C. Refer to a community day program for social activities. D. Provide information about local religious services. Think of the answer before the reveal. The answer is using Maslow's hierarchy of needs, the nurse first ensures access to basic needs such as food, clothing, and shelter. Providing transportation to housing relates directly to a basic need. Giving detailed instructions for follow-up appointments is necessary, but secondary to the need for shelter. Referrals to community social or religious programs may be included in the discharge plan depending upon the desires of the client. Flashcard 45. A client's blood pressure reading has been trending in the 160/90 range. The client's current blood pressure reading is 120/70. Which could be a possible reason for this change? A. The cuff used to measure blood pressure was too large. B. The client has been refusing his beta blocker medication for 2 days. C. The client was arguing on the phone just prior to the assessment. D. The blood pressure measurement was taken on the client's leg. Think of the answer before the reveal. The answer is a cuff that is too large will give a false low reading. Lower blood pressure readings would not indicate a client is refusing blood pressure medication. In fact, if the client was not taking medication to lower blood pressure, the expectation is that the blood pressure would increase. Activities such as talking or even arguing would contribute to higher, not lower than expected readings. A blood pressure reading from the leg may give systolic values at 20 to 30 mmHg higher than readings from an upper extremity. Flashcard 46. The emergency department nurse assesses a client who was involved in a motor vehicle accident. The client has a laceration on his cheeks and nose and bruising over the upper chest. The client says, "I felt lightheaded and my feet were numb, but I got out of the car and walked." What nursing assessment is contraindicated? A. Use a temporal artery thermometer to assess the client's temperature. B. Obtain an orthostatic blood pressure measurement. C. Ask the client to take a deep breath while assessing lung sounds. D. Compare movement of feet bilaterally. Think of the answer before the reveal. The answer is B. A potential spinal cord injury may be indicated with altered sensations in the lower legs. Asking the client to change positions to sit or stand is not appropriate for measuring blood pressure without confirmation that the client does not have a spinal cord injury. The temporal artery thermometer can be used if the facial injury is below the eyes. Assessing the lungs accurately is important after a chest injury. Additional neurological assessment of the extremities is also indicated. Flashcard 47. A 17-year-old male seeking treatment at a clinic reports having fever and chills for several days. The client states that every time he gets sick, his mother sends him to the clinic because she thinks he has human immunodeficiency virus HIV. What is an appropriate response by the nurse? A. Are you concerned that you may have HIV? B. She's just worried about you. C. Have you ever given her a reason to think that way? D. Are you sure that's what your mother says? Think of the answer before the reveal. The answer is all the nurse knows is what the client is reporting. The nurse does not know if, in fact, the client's mother is actually concerned about HIV. The most therapeutic response is to ask the client if he is concerned about HIV. Asking an open-ended question should encourage the client to express his feelings and concerns. The nurse should also reassure him that even though he is a minor, any information he discloses is confidential and will not be shared without his consent or without legal justification. Should the client disclose that he is concerned that he has HIV, the nurse will need to determine more information about the client's sexual relationship and if they might involve abuse. Flashcard 48. The nurse is planning care for a client with a T6 level spinal injury. In conjunction with physical therapy, what types of assistive devices would be included in the plan of care to help with mobility? A. Motorized wheelchair with breath control. B. Crutches and bilateral knee-ankle foot orthoses. C. Bilateral leg braces and a quad cane. D. Torso brace and steerable knee walker. Think of the answer before the reveal. The answer is B. A client with a T6 level injury will have good torso control, but a loss of function below the waist. The client could use knee-ankle foot orthoses, COFOs, and crutches or a walker. A lightweight wheelchair can also be used and will enable independent mobility in all environments. A motorized wheelchair can be used, but breath control is not necessary with a T6 injury. A quad cane will not provide enough stability for transfers or walking. A steerable knee walker is used after lower leg or foot surgeries. Flashcard 49. The client is a 74-year-old male client who is recovering on a medical unit after a suicide attempt that involved carbon monoxide poisoning. The client states that his wife died 1 year ago and he lives alone. Which of the following questions will best assess available client support systems? Select all that apply. A. Have you thought about joining a Christian church? B. Who are you closest to in your family? C. What kinds of support has been helpful to you in the past? D. Why haven't you attended a grief support group? E. Let's discuss the resources available to you after you are discharged. F. I informed your neighbor how best to support you after discharge. Think of the answer before the reveal. The answer is BCE. Many resources and studies identify social support systems as an essential part of suicide assessment SAD person's scale. Since nurses are responsible for assessing client needs and continuity of care, they should be familiar with the importance of identifying support systems and helping the client to engage with those systems. The nurse should identify family members or close friends and review how these individuals have provided support in the past. However, family and friends should be involved in this situation only after the client has given permission to share information with them in compliance with privacy laws. It's important to discuss available resources in the community. While many clients find support in religious communities, a nurse should never suggest a specific sect or denomination. Questions beginning with why usually create a defensive response and should be rephrased. Flashcard 50. The emergency department nurse admits a client who is experiencing diarrhea, abdominal cramps, fever, and headache. This is the third client admitted today with the same symptoms. All three clients stated they attended the same local air show yesterday. Which of the following actions should be the priority? A. Alert the nursing supervisor and discuss the need to contact public health authorities regarding the similarity of the cases. B. Suggest placing all clients in the same room until a cause for their symptoms can be determined. C. Ask the client for permission to talk with the family members regarding their symptoms. D. Determine what foods the clients ate while attending the air show. Think of the answer before the reveal. The answer is the nurse should be alert to illness patterns that could indicate an infectious disease outbreak. Although 3 clients in one hospital does not necessarily signal an outbreak, the nurse may not be aware of clients seeking care in other healthcare settings. The nurse should contact the nursing supervisor about the similarity of the cases and discuss the need to contact public health authorities. Placing the clients in the same room may be appropriate, but it is not the priority. Although family members may have important information to share about the client's symptoms, the focus of the care is the client family members do not need to be assessed at this time. While the symptoms seem to be food-related, other factors could also be the cause of the symptoms. Flashcard 51. The nurse is present when a researcher provides information to a client about participating in a clinical research trial. Later, the client tells the nurse, "I do not want to be included in this research, but I'm afraid my doctor will be upset if I do not." What action by a nurse is indicated in this situation? A. Inform the client that it is a wonderful opportunity to do something that will help so many others. B. Suggest that they contact the researcher together and ask for the client to be withdrawn from the study. C. State that if the healthcare provider wants the client to participate, it's important to participate in the study. D. Explain that it is too late to withdraw now that the consent form has been signed. Think of the answer before the reveal. The answer is B. Clinical trials are an important part of medical advances, but no one should ever feel pressured to participate. Most clinical trials are approved and monitored by an institutional review board in order to ensure the clinical trials are ethical and the rights of participants are protected. Informed consent provides potential participants with key facts about the clinical trial, and the process of informed consent continues throughout the study. But informed consent is not a contract. Therefore, participants are free to withdraw at any time. The best response is for the nurse to offer to help the client contact the researcher and ask to be withdrawn from the study. Flashcard 52. The client diagnosed with heart failure is admitted to an acute medical surgical unit. The nurse completes medication reconciliation between the home medications and current prescribed medications. The nurse notes that the prescriber has added lisinopril 5 mg by mouth daily to the list of daily medications. What medication would the nurse question as a possible drug interaction with lisinopril? Acute care prescribed medications: lisinopril 10 mg by mouth daily, metoprolol 50 mg by mouth twice a day, glipizide 5 mg by mouth daily, naproxen 500 mg 3 times a day, enoxaparin 80 mg sub-Q every 12 hours. Home medications: metoprolol 50 mg by mouth twice a day, glipizide 5 mg by mouth daily, naproxen 500 mg 3 times a day, enoxaparin 80 mg sub-Q every 12 hours, metoprolol low pressure 50 mg by mouth twice a day, B glipizide 5 mg by mouth daily, C naproxen 500 mg as needed 3 times a day, D enoxaparin 80 mg sub-Q every 12 hours. Think of the answer before the reveal. The answer is C. Non-steroidal anti-inflammatory NSAID drugs, such as naproxen, reduce the antihypertensive effects of ACE inhibitors lisinopril. The use of NSAID and ACE inhibitors may also predispose patients to develop acute renal failure. Additionally, naproxen increases the risk of heart attack or stroke with heart disease. The nurse would clarify the prescribed medications with the healthcare provider. The metoprolol and enoxaparin are appropriate to continue. Enoxaparin for antiplatelet action may also be continued. Flashcard 53. The nurse manager in an outpatient clinic notices that the atmosphere has been tense for the last several weeks, with the staff arguing amongst themselves. Which step should the nurse manager consider next? A. Wait for another week to see if the atmosphere changes. B. Issue a memo instructing the staff members to stop arguing. C. Instruct the staff that arguing must stop or they will be terminated. D. Schedule a staff meeting to discuss the situation. Think of the answer before the reveal. The answer is D. Communication is an essential component of a nurse manager's role. Effective nurse managers must facilitate group communication and keeping communication channels open. Waiting another week may escalate the situation. Issuing a memo is ineffective to group discussion and process. Instructing the staff that they may be terminated is exhibiting power, which may also escalate the problem. Flashcard 54. The nurse is caring for a client with a nursing diagnosis of complicated grieving. Which of the following interventions should be included in the client's plan of care? Select all that apply. A. Determine which stage of grief in which the client is fixed. B. Encourage fine motor activities requiring concentration. C. Discourage client expressions of anger over the loss. D. Communicate that crying is acceptable. E. Teach the client about the normal stages of grief. F. Encourage the client to identify weaknesses that have prevented grieving. Think of the answer before the reveal. The answer is a DE. Complicated grieving is a nursing diagnosis that is an extended, unsuccessful use of intellectual and emotional responses needed to work through the process of grieving and the perception of loss. Priority interventions would be to first assess the stage of grief in which the client is currently fixed. It will also be helpful to teach the client about the grieving process. Other interventions are to communicate the therapeutic value of crying and the therapeutic value of expressing anger. Instead of having to concentrate on fine motor activities, gross motor activities such as walking may be helpful. The nurse should help the client identify strengths, not weaknesses, they will need to work through the process of grieving. Flashcard 55. A client has been diagnosed with a vascular neurocognitive disorder, and the family asks the nurse about the progression of the disease. Which of the following statements should the nurse include in the family education? Select all that apply. A. The course of the disease is degenerative, but it is highly variable depending upon the individual. B. There will be abrupt personality changes along with speech and language deterioration. C. The deposits of plaque and tangles in the brain will interfere with thinking and memory. D. The progression of symptoms can occur in a stepwise fashion with the client seemingly better at times. E. The decline will be rapid and the client will show signs of tremors similar to Parkinson's disease. F. It is important to monitor blood pressure and diet to reduce further damage. Think of the answer before the reveal. The answer is DF. Neurocognitive disorders formerly known as dementia have a variety of etiologies. Vascular neurocognitive disorders are a result of interruption of blood flow to the brain that results in cell death. This can come from a series of small strokes, hypertension, or emboli. The course of the disease is highly variable and occurs in a stepwise fashion, with the client appearing to improve for brief periods of time. Continuous monitoring for vascular problems such as hypertension is necessary. Plaques and tangles are deposited with Alzheimer's disease. Frontotemporal neurocognitive disorder results in personality, speech, and language deterioration. Lewy body neurocognitive disorder produces Parkinson-like symptoms. Flashcard 56. The emergency department nurse is assessing a client who was involved in a motor vehicle accident. The client has a laceration on his face and bruising over the upper chest. The client says, "I felt lightheaded and my feet were numb, but I got out of the car and walked." Which assessment is contraindicated? A. Using a temporal artery thermometer to assess temperature. B. Obtaining an orthostatic blood pressure measurement. C. Asking the client to deep breath while assessing lung sounds. D. Comparing bilateral movement of feet. Think of the answer before the reveal. The answer is B. A potential spinal cord injury may be indicated by the altered sensation in the lower legs. It would be contraindicated to ask the client to sit and stand for an orthostatic blood pressure measurement. As long as the facial injury is below the eyes, the nurse can use a temporal artery thermometer. Assessing the lungs and additional neurological assessment of the extremities is indicated. Flashcard 57. A certified nursing assistant CNA reports to the nurse that another CNA is eating food from the client's trays before serving the trays to the clients. What action should the nurse take? A. Wait until the next meal to observe and then report this behavior. B. Quietly pull the CNA aside, address the situation, and make plans for a follow-up meeting. C. Report the incident to the director of nursing at the next staff meeting. D. Document the alleged incident and place the report in the CNA's permanent file. Think of the answer before the reveal. The answer is B. Nurses must promote, advocate for, and protect the health, safety, and rights of the client. It is never acceptable for a staff member to eat food from a client's food tray. In this situation, the nurse must intervene quietly and address the immediate concern. The nurse must also schedule a time to discuss the behavior in a more private setting. It is not appropriate to wait until the next mealtime to try and observe the behavior, delay addressing the behavior, or document the behavior and place a report in a personnel file without first talking to the CNA. Flashcard 58. Prior to the start of the shift, the nurse becomes concerned about how she can safely care for the number of clients assigned to her. After discussing the situation with the nursing supervisor, the nurse remains concerned about the unsafe staffing ratio. What is the correct action the nurse should take? A. Submit a written statement about the concern to the nursing administration. B. Notify the client's healthcare providers about the nursing care ratios. C. Decline the assignment and promptly leave the unit. D. Inform the nursing staff that she will not accept the entire assignment. Think of the answer before the reveal. The answer is: in order to provide safe and effective care, appropriate staffing and skill mix levels are needed. When there is a concern about staffing, the nurse should contact the nursing administrator or immediate supervisor right away. Then the nurse should submit her concerns in writing and, if possible, address any ongoing concerns about staffing ratios. Nursing administration is responsible for nursing, not the health care provider. Leaving the unit would be considered patient abandonment. Refusing to accept an assignment would be inappropriate and counterproductive. Flashcard 59. An adolescent client is being treated for polysubstance abuse. The client states, "I don't need to give up marijuana because it is legal and doesn't harm me." Which of the following statements is the most appropriate response? A. Evidence shows that marijuana has negative effects in the brain, heart, and lungs. B. Some people may not experience health problems from marijuana. C. Marijuana smoking is unhealthy, but not as harmful as smoking cigarettes. D. It will depend upon how much marijuana is smoked. Think of the answer before the reveal. The answer is: marijuana's active ingredient THC binds with the opioid mu receptor in the brain and blocks dopamine reuptake. Not only is marijuana addictive, its use results in impaired ability to form memories, recall events, and shift attention. Due to the same carcinogens as tobacco, smoking marijuana has negative cardiovascular and respiratory effects. Imparting factual knowledge to the adolescent is the first step in opening a discussion about marijuana use. While many people who smoke marijuana do not experience immediate major health problems, there is increasing evidence that adolescents are more vulnerable to the harmful effects than adults. Therefore, minimizing the risk is not an appropriate response. While the amount of smoking may make some difference, the response that equivocates the effects of marijuana on adolescents is not an accurate nursing response. Flashcard 60. The health care provider determines that a 3-year-old child has otitis media with effusion in the right ear. The parent is concerned about follow-up care. What information should the nurse reinforce? Select all that apply. A. A follow-up hearing test will be done if the effusion persists. B. Antibiotics and antihistamines will be prescribed. C. The condition may resolve without treatment. E. Siblings need to be screened for the condition. E. Report any suspected hearing problems. Think of the answer before the reveal. The answer is: CE otitis media with effusion. OME is thick or sticky fluid behind the eardrum in the middle ear. It occurs without an ear infection. Most providers will not treat OME unless there are also signs of infection. Instead, the child should be monitored and rechecked at a later date. Usually the condition resolves on its own, but if effusions persist, it can result in reduced hearing, which may delay speech and language development. The parent should suspect hearing loss if, for example, the child consistently turns up the television volume. Screening for OME is not indicated. Flashcard 61. The hospice nurse makes a home visit to admit a new client diagnosed with terminal lung cancer. The client is experiencing pain that is not well controlled. The client and partner reveal the client needs more assistance with activities of daily living than the partner is physically able to provide. What actions are indicated for this home situation? A. Meet with the hospice team to revise the client's plan of care. B. Suggest that the couple sell their house and consider long-term care. C. Arrange a transfer to the hospital to treat the client's pain. D. Coach the spouse on how to care for the client. Think of the answer before the reveal. The answer is: a hospice care focuses on providing care and supporting the needs of the client. Typically, a family member serves as the primary caregiver, but in this case, the hospice team will need to meet and revise the client's plan of care since the spouse is unable to provide the needed care. In the meantime, the nurse could arrange for scheduled visits by a home health aide to help with activities of daily living. Even with coaching, the client's partner may be unable to meet all the client's needs. There are many options for pain control, and these can usually be managed at home. It is inappropriate for the nurse to suggest that the couple should sell their home. Flashcard 62. A client is scheduled for discharge. The client's spouse tells the nurse that before this current hospitalization, the client was very restless at night, had problems falling asleep, and would then be tired all day. The spouse is concerned the client will continue having sleep issues at home. What additional teaching would the nurse include with the discharge teaching? Select all that apply. A. Develop a schedule that includes waking up and going to bed at the same time every day. B. Avoid watching television, e-reading, or using a phone or tablet when in bed. C. To help reduce fatigue, you should consider taking 90-minute afternoon naps. D. Exercise, especially a brisk evening walk, can help promote healthy sleep. E. A warm non-caffeinated drink or light snack can help promote healthy sleep. Think of the answer before the reveal. The answer is: a B. Establishing a regular pattern of wake-sleep supports the body's circadian rhythms and, over time, can make it easier to fall asleep. Clients should avoid anything that is physically or mentally stimulating before going to bed, including television, use of electronics, exercise, caffeine, and alcohol. While daily exercise is encouraged, it should be done earlier in the day. A small snack before bed can affect serotonin levels and promote sleep. Short 20-minute naps can help with fatigue, but longer naps can interfere with nighttime sleep. Flashcard 63. The nurse is providing education for parents of adolescents as part of a community outreach program. Which statement made by a parent would prompt the nurse to discuss factors involved in adolescent risk-taking? Select all that apply. A. It is important to me that my child sees me as a friend. B. I know my child's friends and they are often at our house. C. I often monitor my child's social media and internet use. D. My child is always spending time at the skate park with friends. E. When I work in the evenings, my child spends time with friends. Think of the answer before the reveal. The answer is: a D. Adolescents with parents who are involved and set appropriate limits, such as getting to know their child's friends and knowing what they are doing online, are less likely to be involved in risk-taking behaviors. Adolescents who lack parental guidance, such as the case when the relationship is focused on being friends and when parents are not available, are more likely to take risks. Risk-taking behavior is also associated with an increase in injuries. For children who engage in high-risk activities, parents should be educated about the health benefits of protective gear. Flashcard 64. The hospice nurse is orienting a new unlicensed assistive person UAP about the care of dying clients. Which statement by the UAP indicates an understanding of hospice care? A. To help clients conserve energy, I will perform as much care as possible for my clients. B. I should discourage clients from talking about their lives. C. Developing personal relationships with clients is an important part of my role. D. Even if the client requests it, I will not withhold healthcare information from the hospice team. Think of the answer before the reveal. The answer is D. The UAP should encourage clients to be as independent as possible for as long as possible. Clients should be encouraged to discuss their life because it may help clients accept their death. Establishing and maintaining a professional relationship as opposed to a personal relationship is important in any healthcare setting, including hospice. There should be no secrets. If the UAP has information that may potentially help the hospice team provide appropriate client care, then it needs to be shared with the team. Flashcard 65. The nurse is preparing a client with suspected lung cancer for a thoracentesis. The nurse provides education prior to the procedure. Which statement by the client indicates further teaching is necessary? A. I will have to try to not cough, talk, or move around during the procedure. B. I will be sedated for this procedure and will need someone to drive me home. C. After the procedure is over, I will have a chest X-ray done to make sure I'm okay. D. This procedure can be painful, so I will get medicine to help manage the pain. Think of the answer before the reveal. The answer is B. The client will be awake and sitting up for the procedure, not sedated. The client should be medicated with an analgesic prior to the procedure to minimize discomfort during the procedure. The client is instructed to remain still and not to cough, deep breathe, or move during the procedure. The client will need to have a chest X-ray following the procedure to ensure a pneumothorax has not developed as a result of the procedure. Flashcard 66. The hospice nurse cared for a client who is recently deceased. Which of the following nursing interventions would be included in follow-up care after death? A. Attend the client's funeral or visitation service. B. Make sure the arrangements are what the client wanted. C. Help family members dispose of the client's belongings. D. Contact the client's family 1 to 2 months following the client's death. Think of the answer before the reveal. The answer is D. Bereavement services are an essential part of hospice care that includes anticipating grief reactions and providing ongoing support for the family. Bereavement services continue for 13 months after the client's death. 13 months is significant because it includes the first anniversary of the client's death. 1 to 2 months following the client's death, after friends have returned to their normal routines, the nurse should contact the family. Attending a funeral service is an appropriate gesture, but it is not part of follow-up care. Funeral arrangements and disposing of the client's belongings are not the responsibility of the hospice nurse. Flashcard 67. A client is admitted to an inpatient psychiatric unit for the purpose of alcohol detoxification. The client asks the nurse, "When will I be finished with my detox?" "I need to go home tomorrow and feed my dogs." Which of the following is a priority nursing response? A. If withdrawal is uncomplicated, it will take 2 to 4 days for the physical symptoms to resolve. B. You need to accept the program that your doctor has recommended for you. C. If you have a seizure or start seeing things, it is best for you to be here where we can control you. D. Let's see if you can get a pass to go out to feed your dogs. Think of the answer before the reveal. The answer is in this situation, the nurse should respond factually to the client's request for information about the time period for treatment that he should expect to be hospitalized for 2 to 4 days if the withdrawal is uncomplicated. After that information is provided, subsequent conversations can take place about the client's animals. Advising the client to accept the program is not therapeutic. While it is true that a seizure or delirium tremens may necessitate interventions, not all clients experience these effects of alcohol withdrawal, and the word control may alarm the client. Getting a pass to go home in the first 24 to 48 hours is not a correct response. Flashcard 68. The nurse is caring for a terminally ill hospice client. The client is currently reporting pain all over, worse than ever. The nurse assesses the client and records the following data: blood pressure 104/60 mmHg, apical pulse 74 beats/minute, respirations 8 breaths/minute, and shallow. Which intervention would the nurse implement? A. Notify the healthcare provider of the client's vital signs. B. Turn and reposition the patient for comfort. C. Reassess the client in about 30 minutes. D. Administer the ordered pain medication. Think of the answer before the reveal. The answer is D. The central theme of hospice care and palliative care is the belief that each of us has the right to die pain-free and with dignity. The hospice teams develops a care plan that meets the client's needs for pain management and symptom control. The best response by the nurse is to medicate the client according to the prescribed plan of care. Turning and repositioning the client may increase, not decrease, the pain. There's no need to notify the healthcare provider if there are orders in place for pain management. Reassessing the client in 30 minutes is not an appropriate intervention. Flashcard 69. A 27-year-old was admitted with respiratory distress and is mechanically ventilated. Despite medical intervention, the client's condition worsens. The client's partner wants to stop treatment, but the client's siblings are adamant that this isn't what the client would have wanted. What action by the nurse would help resolve this situation? A. Allow the family to discuss the situation and come to a decision on their own. B. Provide education about advance directives and the role of the medical proxy. C. Discuss concerns about the situation with the health care provider. D. Plan a meeting between family and the multidisciplinary team to discuss the situation. Think of the answer before the reveal. The answer is D. When there is family disagreement about how care should proceed, the nurse should promote open communication between the family and the healthcare team. This will provide an opportunity for both the partner and siblings to become involved in treatment decisions. The family has already demonstrated disagreement over treatment, and allowing them to come to the decision without guidance may not lead to a resolution. While the nurse should notify the healthcare provider about the situation, this alone will not help resolve the situation. Education about advance directives is important. However, this information should have been provided to the client before he or she is unable to participate in care decisions. Flashcard 70. While receiving an infusing of an antineoplastic medication, the client reports a burning sensation in the area surrounding the intravenous Roman 4 insertion site. The nurse observes swelling and redness in the affected area. After stopping the infusion, what should the nurse do next? A. Using a syringe, aspirate the medication from the Roman 4 catheter. B. Apply warm moist heat to the area with a pressure dressing. C. Flush the Roman 4 site with at least 10 ml 0.9% normal saline. D. Immediately notify the client's primary healthcare provider. Think of the answer before the reveal. The answer is antineoplastic agents are often vesicants, and if the medication seeps into the tissues, it can lead to severe tissue necrosis. The nurse should immediately attempt to aspirate the medication in an effort to reduce any potential tissue damage. Applying warm moist heat, a pressure dressing, or flushing the medication may increase tissue damage. The nurse would notify the primary healthcare provider after the infusion is stopped and the vesicant has been aspirated from the catheter lumen. Flashcard 71. During an annual physical, the client tells the nurse they have been feeling tired and not sleeping well. What should the nurse include in the assessment of this client? Select all that apply. A. What medications do you take? B. What type of job do you have? C. Do you have difficulty falling asleep? D. Describe your bedtime routine. E. How often do you drink alcohol? Think of the answer before the reveal. The answer is a CDE medication side effects can contribute to fatigue or insomnia. It is also important to assess if the client is taking medications, including over-the-counter and complementary and integrative therapies, to fall asleep. The nurse should ask if the client has a problem falling asleep or staying asleep so appropriate treatment can be determined. Lack of a bedtime routine often leads to difficulty falling asleep, and it is important to determine if the routine includes practices that may lead to poor sleep. It would be more important to determine the hours or shift the client works, not the type of job he has. Flashcard 72. The nurse is providing education to a client who has been prescribed disulfiram for management of chronic alcohol use. Which of the following statements indicate that the client is a good candidate for disulfiram antabuse? Select all that apply. A. I must take the drug at bedtime if it makes me drowsy. B. I will have to remember to take the drug within 4 hours of my last alcoholic drink. C. I will take disulfiram for 6 months when I have completed supervised treatment. D. I will need to wear medical identification to alert emergency personnel that I am taking this drug. E. I will need to keep appointments for follow-up blood tests while I am taking this drug. F. I am so glad that it will stop my cravings for alcohol. Think of the answer before the reveal. The answer is disulfiram is an inhibitor of aldehyde dehydrogenase, which blocks the oxidation of alcohol and allows acetaldehyde to accumulate. If clients use alcohol, they will experience flushing, tachycardia, nausea, and vomiting. This is why clients should wear or carry medical alert identification. Clients taking disulfiram may notice drowsiness when taking this medication and should take it at bedtime. There should be at least 12 hours between the last alcohol ingestion and taking disulfiram. Follow-up blood tests for cardiac, liver, and kidney functions are indicated. Disulfiram does not stop cravings for alcohol. Supervised disulfiram therapy may continue for months or even years. Flashcard 73. The client was brought to the hospital after being found floating in a local river. The client is admitted to the intensive care unit with the following assessment findings. a 3-inch 7.62 cm laceration to the top of the head, bruises to the face, a right humerus fracture and multiple bruises to the torso and legs, pulse 89 beats/minute, respirations 20 breaths/minute, and blood pressure 128/82 mmHg. Which set of vital signs assessed 1 hour after admission requires immediate intervention by the nurse? A. Pulse 1-2 beats per minute, respirations 18 breaths/minute, blood pressure 178 mmHg. Pulse 76 beats per minute, respirations 22 breaths/minute, blood pressure 134/86 mmHg. Pulse 96 beats per minute, respirations 24 breaths/minute, blood pressure 112/64 mmHg. Pulse 56 beats per minute, respirations 16 breaths/minute, blood pressure 148/68 mmHg. Think of the answer before the reveal. The answer is D. The injuries to the client's head and face places the client at risk for a secondary head injury. An elevated blood pressure with widened pulse pressure and bradycardia are indicators of increased intracranial pressure and impending herniation of the brain, which require immediate intervention and notifying the healthcare provider. While the client has other injuries that may affect changes in vital signs, the other values do not indicate a problem requiring immediate intervention. Flashcard 74. A client with a terminal diagnosis is not eating or drinking. Her husband is very concerned. What is the nurse's best response? Select all that apply. A. This is a normal part of the end of life. B. An intravenous drip can be started for her. C. A feeding tube can be inserted. D. Pain is decreased with dehydration. E. Feeding her may cause nausea. Think of the answer before the reveal. The answer is a D. Lack of eating and drinking is an expected part of the dying process. The provision of intravenous hydration can have a negative impact on quality of life by increasing pulmonary secretions, urinary output, nausea, vomiting, and edema. Water deprivation increases the body's production of endogenous opiates that create a euphoric state and has been associated with reduction in pain. Studies of patients who are dying have indicated that thirst and hunger are not a significant problem when patients decide to forego nutritional support and hydration. Flashcard 75. The hospice nurse is caring for a terminally ill client at home. During one care encounter, the client and spouse voice concerns about never doing everything we wanted to do. Which philosophy should the nurse use to help them best cope? A. Anticipate the worst and plan for it. B. Plan for good times ahead. C. Relive past pleasant memories. D. Live each day to the fullest. Think of the answer before the reveal. The answer is D. At the end of life, assisting patients and loved ones to focus on the present by living each day to the fullest is the most appropriate philosophy. Focusing on the past can interfere with living in the present. Expecting the worst makes focusing on the present difficult. With the uncertainty of the length of life with terminal illness, planning for the future is inappropriate. Flashcard 76. A client seeks help for family problems at an outpatient mental health clinic. The nurse conducts an initial intake assessment to determine family functions. Which questions are most appropriate to ask during the initial intake assessment? Select all that apply. A. Why do you have conflict with your family? B. Where do you fit in your family? C. How does your family make decisions? D. Who in your family is supportive of you? E. Do you drink alcohol or use recreational drugs? Think of the answer before the reveal. The answer is BCD. The nurse needs to establish a rapport with the client during the initial intake interview. Open-ended questions asked in a relaxed atmosphere should provide valuable assessment information. Asking a client about fit in the family, how decisions are made, and supportive measures perceived by the client are all appropriate questions. A question that begins with why may place the client in a defensive mode. Also, mentioning conflict in an initial intake interview may obscure other valuable foundational assessment information about the client and family roles and functions. Questions leading to yes or no answers related to drug and/or alcohol use may yield incomplete data. Flashcard 77. A client is involuntarily committed to a psychiatric facility. During an assessment, the client reveals to the nurse a plan to harm a specific family member. Which of the following actions is a priority? A. Notify the healthcare provider and ensure the family member is notified of the threat. B. Encourage the client to discuss the plan to harm the family member with the healthcare provider. C. Incorporate the client's plan to harm a family member into the nursing plan of care. D. No action is necessary because the client's statement is protected as confidential information. Think of the answer before the reveal. The answer is A. Based upon a legal decision Tarasoff v. Regents of the University of California, professionals are mandated to report specific threats to the person being threatened. The onus of responsibility to report also falls on the healthcare provider, and therefore, he or she must also be notified. The nurse can encourage the client to discuss the plan with the healthcare provider and incorporate the client's threats into the nursing plan of care, but these are a lower priority than the legal mandate to report. Confidentiality is void when there is a specific threat to a named individual. Flashcard 78. The nursing supervisor overhears a conversation between the nurse and a client with a substance disorder. The client insists that no one can help him. Which of the following responses by the nurse should be of concern to the nursing supervisor? A. I have extensive experience and will be able to help you overcome your addiction. B. I am sensing you are discouraged with your current situation. C. I would like to hear of your past experiences with treatment. D. I have planned a conference with your physician and social worker to evaluate your current treatment. Think of the answer before the reveal. The answer is A countertransference is a risk for a nurse caring for a client with addiction. Patient behaviors may trigger overwhelming emotional reactions and result in the nurse being less effective in the therapeutic relationship. Reassuring the client that the nurse is the one who will be able to help may indicate that the nurse is responding to the emotional pressure presented by the client. The other options are therapeutic responses because they seek clarification, more information, or involve further assessment. Flashcard 79. A client is scheduled to receive an oral solution of radioactive iodine 131I. What information is the priority for the nurse to include when teaching the client about this treatment? A. Your family can use the same bathroom as you are using, without any special precautions. B. Drink plenty of water and empty your bladder often during the initial 3 days of therapy. C. In the first 48 hours, you should avoid contact with children and pregnant women. Be sure to flush the commode twice after urination or defecation. D. Use disposable utensils for 2 days. If you feel nauseous within 12 hours of the first dose, please vomit in the toilet and flush it twice. Think of the answer before the reveal. The answer is C. The client's urine and saliva are radioactive for 24 hours after ingestion, and vomitus is radioactive for 6 to 8 hours. The client should drink 3 to 4 liters of fluid a day for the initial 48 hours to help remove the 131I from the body. To minimize exposure to radiation, nursing staff should plan to give care in the shortest time possible. Less time equals less exposure, working as far away from the radiation source as possible. Each nurse should also wear a personal film badge or pocket dosimeter. Flashcard 80. The nurse is planning care for a client who is recovering from a stroke. The client is unsteady on his feet and uses a walker. Even though there is an activity order to ambulate with assistance only, the client often does not wait for assistance to walk to the bathroom. Which plan will not only help protect the client from harm, but also reduce the nurse's legal liability? A. Remove obstacles and arrange a clear pathway to the bathroom. B. Ask the physical therapist to review the activity order. C. Follow agency policy and procedures for fall prevention. D. Document the fall risk assessment in the healthcare record. Think of the answer before the reveal. The answer is C. The best plan is to implement interventions that will reduce the risk of falling, and this involves following the healthcare organization's fall prevention policy and standards. Most lawsuits for malpractice will seek to determine if the nurse followed standards of care and agency policy by properly monitoring the at-risk client. A clear pathway may be appropriate. However, this alone will not reduce the immediate fall risk, and the client is not supposed to get out of bed without help. Documenting the completion of a fall risk assessment is an appropriate action, but it is only part of the overall plan to protect the client. Asking the physical therapist to review the orders will not protect the client from harm. Flashcard 81. The nurse is providing education to a family member of a client diagnosed with a pathologic gambling disorder. Which of the following statements indicates that learning has taken place and the family member understands the disorder? A. I will challenge his overconfident statements about winning. B. I will restrict access to money sources, which will decrease the urge to gamble. C. I will praise winning streaks and disapprove of losing streaks when he gambles. D. I will encourage a buddy system and provide a companion for him when he gambles. Think of the answer before the reveal. The answer is a pathologic gambling is a non-substance use disorder that's similar to other addictions. It is marked by the client feeling omnipotence, coupled with a relentless pursuit of winning back losses. This overconfidence removes rational thought about the hazards of gambling and likelihood of losing. Therapeutic interventions involve confrontation of overconfident thoughts and behaviors with reality-based statements. Restricting resources may be effective short-term, but it is impractical. Besides, any participation in or encouragement of gambling will delay the recovery process and allow the client to remain in denial about the serious nature of the disorder. Flashcard 82. A hospice nurse arrives to make a scheduled visit with the client in a long-term care facility. The nurse is approached by the facility staff who want the client sent to a hospital due to an exacerbation of symptoms. What is the first action the hospice nurse should implement? A. Explain that the client can be kept comfortable in the long-term care facility. B. Check with the client to see if he wants to go to the hospital. C. Call a hospice care team meeting to discuss the staff's request. D. Discuss the concept of comfort care measures with the staff. Think of the answer before the reveal. The answer is B. A client on hospice care is allowed to go to the hospital, especially when the client needs urgent care. The hospice nurse will assess the situation and ask the client if they want to be transported to the hospital. If the client decides to stay in the long-term care facility, the hospice nurse can reinforce comfort care measures with the staff. If the client is hospitalized, a hospice team meeting may be needed to review the client's status and plan of care. Flashcard 83. The charge nurse sends a certified nursing assistant CNA to help a registered nurse RN with the admission of a client with multiple health problems. Which of the following tasks would be appropriate for the CNA to perform with the nurse during the admission process? Select all that apply. A. Collect a urine specimen. B. Orient the client to the room. C. Observe and document the client's ability to walk to the bathroom. D. Obtain routine vital signs: temperature, pulse, respirations, blood pressure. E. Assist the client to change into a gown. Think of the answer before the reveal. The answer is A. B. D. E. CNAs can obtain routine vital signs, measure height and weight, and obtain urine specimens. CNAs also routinely help clients with activities of daily living adults. Although nursing assistants can measure vital signs, it's up to the RN to determine how to use this data when developing the plan of care. The CNA cannot assess clients or perform any of the other steps of the nursing process. Any nursing intervention that requires independent, specialized nursing knowledge, skill, or judgment must be performed by a nurse. Flashcard 84. The nurse has just listened to the change of shift report on an orthopedic unit. Which of the following clients should the nurse check first? A. A 16-year-old who had an open reduction of a fractured wrist 10 hours ago. B. A 20-year-old in skeletal traction for 2 weeks since a motorcycle accident. C. A 75-year-old who is in skin traction of the left leg prior to a scheduled fractured hip repair surgery. D. A 72-year-old who returned from a right hip replacement surgery 2 hours ago. Think of the answer before the reveal. The answer is D. The nurse should compare clients to screen for one who has the most imminent risks and acute vulnerability for being unstable. The client who returned from surgery 2 hours ago is at risk for hemorrhage because the hip and femur are considered vascular areas and should be checked first. The 16-year-old is within the initial 24 hours post-op period and should be seen next. The 75-year-old is potentially vulnerable to age-related physical and cognitive impairments from being on bed rest and having a large bone fracture. The client who can safely be visited last is the 20-year-old who is 2 weeks post-injury. Flashcard 85. The family of a client diagnosed with schizophrenia is upset to learn that there is an order to transfer the client from a locked inpatient facility to a community group home setting. The family tells the nurse that they need the client's stay to stay in the locked facility. Which response by the nurse is most appropriate? A. It violates the principle of least restrictive environment if the client, who qualifies for community placement, is kept in a locked facility. B. In keeping with the principle of beneficence, the healthcare provider decides on which placement is best for the client. C. Due to confidentiality issues, you will need to take your concerns directly to the healthcare provider. D. If the client agrees to stay, I will submit a request for voluntary commitment to protect the client's right of self-determination. Think of the answer before the reveal. The answer is: clients have the right to be treated in the least restrictive environment. Additionally, a client cannot be restrained or locked in a facility when less restrictive options are available. A healthcare provider and nursing team assess a client's ability to function in a less restrictive setting and initiate transfer when appropriate. Ethical principles of beneficence, confidentiality, and self-determination are important, but are not the overriding principles in the decision to move a client from a locked facility to a less restrictive community facility.